please come and fill in the seats here. Come on down. All right, thanks for coming back. So, first I want to see, do people, if people want little post-it notes, if you want to write some things down for me to read at the end, then maybe we can have someone go around with some post-it notes, and people can, that way people can add some things as we go. But I took the post-it notes off the back there, and I split them up randomly. So I'm just going to read you what you've written. So, trust is loyalty. Trust is falling into someone who catches you. Trust is not lying. Oh yeah. I don't know, but patients have a great lie detector. They really know when you're not being genuine with them. I think that's human beings in general, but especially in that dynamic. Trust is knowing each other over time, having complete confidence in another person or thing, or car, or medication. Okay, having trust in your car, that's important. Trust is being a reliable outlet. Trust is honesty and transparency, feeling safe and unconditionally. Being vulnerable to someone else and believing they won't hurt you. Trust is creating a non-judgmental zone, open and appreciative. Trust is knowing someone has your best interest in mind. Trust is communication. Trust is connection. Trust is everything. I'm going to stop on that one. I'll get my seat there. Okay. So ready for the second half of the evening? Yes. Let's hear it. Come on. We want to make sure that the speakers for the next half feel pumped up, right? Because, it's like all this adrenaline, and you're like, when am I going to be up there? Okay, so next is Juliana Morris. Dr. Morris is a family doctor with the San Francisco Department of Public Health, Go Public Health. Part-time faculty with UCSF. I love how everyone keeps saying SFGH. We just will not change the SFGH Family Medicine Residency. And an organizer with the Do No Harm Coalition. She is passionate about combining her work in primary care with community organizing, racial justice, and immigrants' rights. I've never met you, so I don't know where to look. Come on up!
Hello. 4 months into medical school, it was time for my first clinical interview. I was very excited. Not to say that I didn't put my effort into learning all of the biochemistry and basic medicine that was sitting in lecture halls the first several months, but of course this was going to be my moment. I came in because I wanted to be with people, and I felt like this was going to be the moment that I could shine. All these years before medical school that I had done community work, sitting down with people in groups on the ground, talking, getting to know each other, getting to dig deep, learning about each other's issues. I was ready to do that in community and partnership with my patients. So, I am in the community hospital where I'm doing my patient-doctor rotation. Get on my short white coat, get my clipboard, the list of questions divided in nice grid fashion, and we walk into the room of the patient that has been assigned to me. And I'm accompanied by Mark, our faculty, who's a social worker and teaching us in this course. Well, first of all, I forgot to turn on the light, so I spent the first couple minutes sort of talking in the very dim light with the patient, letting her know what we're about to do. Mrs. Mark helped me out with that. Mrs. D was in her 60s. She was in for a respiratory issue, and she was near discharge. And I was there to kind of go through the whole medical history. So I'm in my chair, got my clipboard, start going through the questions. What's your name? How old are you? What brought you into the hospital? Oh, I couldn't breathe. Okay. And looking at my clipboard, what's the next question? And so what are your medical problems? Oh, you know, that I have trouble breathing, and how am I going to get this information? And looking, and Mark is there, like, hurry up. And we go on like this for a little while, and eventually Mark actually says, well, you know what, we're going to take a little break right now. So we step outside of the room, and I remember it's almost like a triage area. I'm not really sure how logistically this happened, but we were in this triage area with a curtain that we close behind us, and I sit down on the gurney that's in there, and he asks what's happening, what's going on, and I just start bawling. I can't do it. I thought I would be great at it, but I really can't do it. And I was, it was also on top of it feeling very embarrassed that someone was there observing it. Felt bad for the patient, since I think it was pretty obvious what was going on. He starts asking me questions, and sometimes I wonder what would have happened if it had been an MD preceptor and not a special work preceptor. But in any case, he starts asking me questions. Why is this? Why? And it really made me think. Brought me back to why I wanted to go into medicine, go into primary care, why the types of connections I wanted to make with people. And as I was telling him all of this, it was all spilling out with my tears, he really listened. And he said, well, it's going to be a process. You'll get there. For now, why don't you make it easier on yourself and actually give yourself a chance to get to know the patient before delving into all these questions? And he provided me with a sample question. So we go back in the room, we sit back down, and I ask, okay, Mrs. D, we're gonna start over again. Thank you so much for your patience. She was very nice. I do want to go into your medical history and learn more details about why you're here in the hospital. But before we get into that, can you tell me something about yourself as a person? And she answered. She told me that she was from Portugal and that she had, some number of kids and the things she liked doing for fun. And she didn't share a ton, but there was this moment where I just felt relaxed. And the agenda wasn't in my court. She was leading that moment of the interaction. And suddenly I felt okay. And the rest of the interview still certainly had its awkward moments as I learned to ask all these questions. But I felt like it was the first step in being able to have some trust that I will be able to get where I want to go. And it involved creating a moment where she could develop some more trust in me as a person who's interested in her as a person, not just this symbol of a white coat that I'm expecting her to blindly trust me with no further connection. So I continued with my question, and it was very interesting because over the next few years, some people would respond with great confusion to the question, like, what do you mean? But the vast majority of people seemed to really respond and would tell me all different sorts of things. Some people would launch into their medical issues, and some people would tell me about what they did 50 years ago. So it was a wonderful way to just let someone meet me on their terms. And over the years, the question has kind of faded away as I've learned to connect with people in lots of different ways and get at this information in different ways. And yet, a couple of years ago, my friend, who is a PEDS chief here, I ran into her and we were reminiscing. She was in my class. And she tells me that she still uses that question with the same wording. And I was stunned. Wow, it's true. That question can still be really powerful. And I've started incorporating it back into my practice, especially as I meet new people, with really interesting results. And that's it. I'm very grateful to have been able to have that support in making these steps forward in developing trust in myself and creating the space for patients. So thank you very much.
Yeah, it just made me think of the question of, what brought you here, right? Often the way we ask people, like, to tell us what brings them to the clinical encounter, or how did you get to be here? But said in a way that's really saying, I want to know who you are more than just this moment and this set of symptoms that you have. And giving people a sense of comfort because they can sort of be themselves. So I think that's, just remembering that it's so hard to not just sort of try to get to the point and get through the question, so to speak, in a way that then you end up sort of shortchanging things and maybe taking longer in the end. So that's really great. And then the other part is, Mark was his name, the social worker? Those social workers. I think that I could imagine a very different interaction with a physician preceptor that would have been more like, did you prepare for today? What is wrong with you? So Mark's trust in you, that you would get there one day. It wasn't maybe going to be that day, but he knew you were going to get there. Is something that we also have the power to hold for people. Is the trust that things will get better for them, and hold out that hope for them. There's that other word, hope. Holding the hope that things can be better, and trusting that if we just stay on this journey together, things will happen, and oftentimes good things will happen. So it's important to know that, pay it forward for the people who trusted you to let you into medical school, and to trust the patients in front of you to kind of be partners with you, because they can't always see what you can see. All right, thank you. All right, so next.